I now recognize Mr. Bean.
Thank you very much, Mr. Chairman. Good afternoon to you, and good afternoon, Ways and Means Committee, and to our panelists. Welcome. We're glad to have you here. I, like Dr. Murphy from North Carolina, am a big fan of managed care. I was a state legislator for many years in the free state of Florida. We partnered with managed care to get our spending under control, and I think Florida has one of the largest state surpluses in the nation, is because we finally worked to make that happen. But I'm going to be honest with you guys. I am as confused as can be. I was hoping to learn what is the deal with managed care, because we've heard that the quality is high, but yet costs are, we don't know. Is it better than fee-for-service cost-wise or not? What if there was a bill? What if there was a bill that required CMS, hear me out, CMS to release the full data of managed care versus fee-for-service, so we could see once and for all where the savings are and what's happening? I got good news, Ways and Means. I have filed that bill. I call it the apples to apples bill. Let's let CMS release the full data so we can make a full decision of where we need to go. I think healthcare is kicking our financial fanny as a country, and until we get those costs under control, then we're going to struggle with debt. So, first question, here we go, Mrs. Maroney. Some say we're saving money, some say we're not saving money on managed care. We know there's benefits. So can you tell me, is Medicare Advantage delivering a cost-efficient solution for seniors and taxpayers?
Absolutely. When you look at the average consumer or beneficiary that enrolls into an MA plan, they're older than 71 years old. The average premium is about $17 for those individuals. However, for our program, most of those individuals have a zero premium plan. They have full comprehension when it comes to the Part C and the Part D. How do you know?
Do we have full data? You feel really comfortable if I would ask you on a scale from 1 to 10, how confident are you on that answer? What would it be?
Probably about 9.5.
Okay, so you say there's room for improvement of that answer. So let's go to Dr. Miller, because you've talked about this in your testimony that we're not comparing. In fact, you've said it's apples to oranges, some of the data that we're getting from CMS. Wouldn't this be a good bill? And if you were in Congress, would you vote for the Bean bill, apples to apples?
I mean, I'd have to read the details, but I agree with the principles. I think right now we're doing apples to kumquat trees. So I'd take it a step further. The problem is that we're only looking at the beneficiaries who switch from fee-for-service to Medicare Advantage. We're not looking at beneficiaries who switch from Medicare Advantage to fee-for-service, and we're certainly not looking at the choice that millions of Americans make when they enroll in Medicare and comparing those bennies who are in fee-for-service and Medicare Advantage. So that 22% number, I actually think that it's not accurate because it only represents a small share of the Medicare population, and there was no control group.
10-4, no, thank you so much. Dr. Basil, welcome to the party. Jump in. What say you to having, I know docs like to have more information than less information, so what say you?
So as far as in my comments, one of the things we asked for was greater transparency. And so transparency is absolutely something that we support. Now, you asked about, how do you compare the quality before? And I can say that, within our own shop, in many ways, some of our Medicare Advantage patients actually have higher level of qualities. The percentage of our Medicare Advantage patients that get annual wellness visits is actually much higher in our MA plans than it is in our traditional Medicare plans, and many other quality metrics are that way. But we don't have that full realm of quality outcome to be able to compare apples to apples, I would agree.
10-4, in the state of Florida, what we do is we capitate the plans. We pay them, we already knew what fee-for-service was. We came in much under that and allowed managed care to go forward. Is there fraud and savings to be found? I'm working with this DOGE, the DOGE conference, so to speak, to work on savings. Is this a good place to look, Dr. Miller?
I'd say there are a couple bad actors that definitely probably deserve a visit with the Department of Justice, but on the whole, the program, I would say, from a fraud, waste, and abuse perspective, is not the major target.
10-4, 60 out of the 550 MA plans were audited last year. President Trump says we need to audit all of them. With that, I yield back. Thank you, Mr. Chairman.
Representative Aaron Bean, Republican Florida, expressed his concerns about the cost efficiency of Medicare during a discussion with Dawn Maroney, CEO of Alignment Health Plan and President of Alignment Health. He shared his background as a former Florida legislator, crediting the state's successful fiscal policies with managed care, which helped control spending and led to one of the largest state surpluses in the nation. However, despite his support for managed care, Bean admitted he was confused about how it stacks up financially, particularly when compared to traditional fee-for-service models. He suggested that there was a need for more transparency in the data regarding the costs and benefits of managed care versus fee-for-service. To address this, Bean introduced his Apples to Apples bill, which would mandate that CMS release full data comparing the two systems. By doing so, lawmakers and the public could have a clearer picture of where savings are being realized, allowing for a more informed decision about the future of Medicare. Bean further questioned whether Medicare Advantage, MA, is truly delivering a cost-efficient solution for seniors and taxpayers. Maroney responded by explaining that the average premium for MA plans is around $17, with many beneficiaries paying nothing out of pocket. She explained that most of the enrollees are seniors, typically over 71 years old, and the program offers substantial benefits, such as annual wellness visits, which are often more frequent in MA plans than in traditional Medicare. However, when Bean pressed Maroney about the accuracy and reliability of this data, she expressed confidence, rating her certainty at 9.5 out of 10. Bean remained curious, asking if there was room for improvement in the data. Maroney acknowledged that more transparency could help. Dr. Miller, a fellow panelist, chimed in, pointing out the flaw in comparing the two systems. He explained that current data only looks at beneficiaries who switch from fee-for-service to Medicare Advantage but does not take into account those who switch in the opposite direction, nor does it consider the choice millions of Americans make when enrolling in either system. He argued that this incomplete data leads to inaccurate conclusions about the cost efficiency of each model. Miller supported the Apples to Apples bill, agreeing that a more thorough and balanced comparison is necessary. Dr. Basil added to the discussion by advocating for more transparency in healthcare. He noted that in his own practice, MA patients often have higher levels of care, such as more frequent wellness visits, compared to those in traditional Medicare. However, he agreed that the lack of comprehensive data makes it difficult to make clear comparisons across the two systems. The conversation then turned to potential fraud and savings within Medicare Advantage. While acknowledging that there may be a few bad actors, Dr. Miller emphasized that fraud is not widespread in the program. He noted that 40 out of the 550 MA plans were audited the previous year, but that President Trump had called for more extensive audits of all MA plans. Representative Bean ended the conversation by pointing out that a small percentage of MA plans were audited, suggesting that a broader approach to audits could help identify further areas for cost savings and fraud prevention.